The UC Health Southern Region would like to welcome you to Memorial Hospital North, located in Colorado Springs, Colorado. The state-of-the-art 130-bed hospital opened in 2007. Pertinent to today's tour, this hospital houses a State of Colorado designated Level 3 trauma center. Beginning our tour of the facility, the hospital's helipad is located on the southwest corner of the grounds. The helipad is square in shape, clearly marked with a red cross, designating it for exclusive hospital use. It is appropriately lit for nighttime traffic and is under continuous surveillance by video camera feeds to both the hospital's emergency department and its transportation coordination facilities called Lifeline. The Lifeline Transport Coordinator is the centralized source for notifications and deconfliction processes for all helicopter and critical care transport. The Transport Coordinator not only monitors and directs all air traffic for UC Health, but is also in communication with area flight programs. On the hospital's southwestern face is a covered ambulance bay with two separate entrances into the emergency department. One entrance is a designated entry into the hospital's decontamination area, and the second entrance leads into the emergency department proper. The emergency department consists of 26 beds total and has recently expanded its physical space to include a spacious EMS lounge. The decontamination area off the ambulance bay is specifically designed and equipped to provide a safe environment for decontaminating ambulatory and non-ambulatory victims of a hazardous materials incident, while limiting possible contamination to the hospital facility. The decontamination area itself has auxiliary heating with independent controls for ambient temperature regulation and designated self-contained drainage and ventilation systems. It is constructed with high-flow, high-volume showers with warm water irrigation. Housed near the decontamination area is personal protection equipment, including PAPRs and all other necessary supplies and decontamination equipment. Conveniently located near the ambulance bay entrance are two trauma resuscitation rooms. These rooms have independent temperature controls and are kept closed to conserve heat. The rooms are completely equipped to provide resuscitative care to patients of all ages. Examples of equipment housed within the trauma rooms are airway management supplies, a ventilator, Belmont rapid fluid warmer and infuser, in-wall suction, cervical spine collars, tourniquets, VEDAS access equipment for central, peripheral, and interosseous access, an ultrasound machine, and a portable computer to access the hospital's information technology systems. In addition, surgical trays for emergent procedures such as thoracotomy, cricoid thyroidotomy, and chest tube placement are easily accessible. Each trauma room stretcher has the capability to weigh a patient. In the event a pediatric patient requires our services, a Broslow tape, length-based resuscitation tape, is placed on the stretcher for rapid estimation of a patient's size. On the walls of the trauma room are numerous informational posters serving as an easy reference for trauma team members during a resuscitation. Immediately adjacent to the emergency department is the radiology department. The trauma resuscitation rooms have direct line access to CT, while the MRI scanners are a short distance away. All trauma patients are accompanied by an emergency department nurse when being transferred to the CT or MRI scanners, and where appropriate, travel with portable oxygen and cardiac monitoring. For intubated patients, a respiratory therapist will also accompany the patient. Similarly, intubated patients or those considered at risk are accompanied by either the trauma surgeon or the trauma team advanced practice provider. The CT scanners are Siemens Definition Edge and Canon Aquilion 64, housed within an appropriately shielded room and continuously operated by a CT technologist. Upon notification of a trauma activation, the CT technologist, if needed, will safely clear the scanner of other patients, move them to another safe location, and prepare it for the trauma patient. The scanner is then held open until all scans for the trauma patient are completed, or the technologist receives direct communication from the trauma team that CT scanning for the trauma activation patient is not necessary. Complete resuscitative equipment is readily available to provide advanced life support for adults or pediatrics, including emergency medications, difficult airway management tools, and defibrillation in the adjoining trauma resuscitation bays. The MRI scanner is a Siemens Avanto 1.5T magnet that is similarly configured and equipped with emergency equipment that is placed outside of the magnet's influence. MRI staff are in-house Monday through Thursday, 7 a.m. to 3:30 a.m., and Friday through Sunday, 24 hours a day. Radiology leadership is on duty 24/7, and a radiology manager monitors the board and calls in needed staff after hours. In the event of a patient requiring blood products, the blood bank maintains an inventory of 85 units of packed red blood cells, 80 units of plasma, of which 4 remain thawed at all times, and 4 units of apheresis platelets. All laboratory orders originating from the emergency department are automatically given stat priority. Type and screen turnaround time is within 60 minutes, but uncross-matched emergency release blood products are available within 5 minutes. The hospital has a massive transfusion protocol that can be initiated from any clinical area of the hospital by phone call or runner. In the ED, staff utilize a red phone to connect with blood bank to provide required patient details directly. Once initiated, the protocol continues until canceled by the trauma surgeon. The hospital has 8 state-of-the-art operating rooms. The trauma surgeons provide 24 hours a day, 7 days a week call coverage, with an expected 30-minute call response to the OR. The OR and PACU staff are in-house 24/7, and an anesthesiologist is available in-house 24 hours a day, Monday through Friday, and from 8 a.m. to 5 p.m. on weekends, with an on-call schedule for emergent trauma procedures. Staffing in the OR includes 24 hours a day, 7 days a week nurses who can respond to full trauma activations when not actively in the OR. When the nurse is in the OR, the trauma surgeon calls the charge phone to discuss need for OR staffing support and space. All provider and staff response times are monitored and addressed through the trauma program's performance improvement process. The OR is equipped to provide comprehensive surgical services within the context of the program's scope of care. Specifically, each OR is equipped with rapid fluid infusers, thermal control equipment for both patients and fluids, has intraoperative radiological capabilities, equipment for endoscopy, and fracture fixation hardware, along with equipment consistent with contemporary trauma surgical practices. While in the recovery room, the immediate needs of the trauma patient are provided by the PACU nurse. Supporting the PACU nursing staff and providing primary oversight of the PACU patient is the operating or trauma surgical service, with support from the in-house staff anesthesiologist. The ICU is a 10-bed unit that has both critical care and general surgical leadership. Newly admitted trauma patients that need critical care services are evaluated and resuscitated by the trauma surgeon on call. If an ICU admission is needed, the pulmonary critical care physician is consulted for management assistance into the ICU. A pulmonary critical care physician is always available 24/7 if requested by the trauma team. Nursing is provided to trauma patients based on a patient acuity model. To best meet the trauma patient's ever-changing needs, the nurse-to-patient ratio is maintained at either a 1-to-1 or a 1-to-2 level. The unit is completely equipped with the resources consistent with contemporary critical care practice. Examples of these resources include availability of mechanical ventilatory support, arterial pressure monitoring, central venous pressure monitoring, and active patient rewarming techniques. When medically appropriate, the rehabilitation gym is available for therapeutic evaluations and treatments. This concludes our facility tour. At UC Health Southern Regions Memorial Hospital North, we are very proud of our trauma program and how we have grown to improve the lives of our patients and community. We look forward to sharing with you some of those accomplishments during your virtual visit to our center. We appreciate your interest in helping us innovate, and we look forward to your feedback.